Hi, it's Dr. Shiller. Today I want to answer this question that's come at me a number of times recently. For someone who's got chronic pain or fatigue, who's already got some kind of meditation, prayer, quieting the mind practice, and maybe they're doing physical therapy and it's not helping, or maybe it's hurting, or maybe they're not doing physical therapy. In any case, what does it add to do something like movement towards health? Where I'm putting out this importance of doing mindful integrative movement. Like, what does that really mean and what's its real impact? So, let me try to explain that starting off with a little story. And this is someone named Barbara, who was one of the first patients I saw when I finished my residency training, who really opened me up to this whole area. I'd already been practicing stuff like Tai Chi for many years, and I already felt its potency and power and intuitively knew how valuable it was, but I didn't really see the clinical impact on patients yet. So she comes to me, she's had this horrible pain syndrome in her neck that happened after she fell down, strained her neck, had a mild head injury, developed horrible pain going into her arm and wrist and tingling, also had bad headaches. She was really completely disabled. She was a teacher, she was a young woman, and her life was completely destroyed by this situation. She wasn't sleeping at night. She felt that things were spinning out of control. And she'd been to neurologists and orthopedic surgeons and neurosurgeons, and everyone had worked her up and like, okay, we don't find anything wrong with you. Here are some antidepressants. Anybody hear that? It could be a similar story for someone who already had a surgery on her neck or her shoulder. And after the surgery, the orthopedic surgeon says everything's been fine, but the person's still having horrible pain. Because I got like a dozen people I've met like that too over the years, unfortunately. But so what did we do together? First, we started just typical mindfulness training, meditation, reduce the stress, try to help her sleep, some more targeted medication interventions, and that helped a little, but she was still really stuck with her movements and was really troubled with that. And then I connected her with a colleague who was a physical therapist who had really done extensive training in yoga and integrated that in his physical therapy practice. And so I might take some heat from my friends who are physical therapists right now, but I'm going to say that what's offered in that system is not only a way of taking meditation and bringing it into motion, but there is a biomechanical intelligence in these Eastern movement systems that seems to work with the integrated intelligence that's in the movement system in your body. And so that's what's attracted me, both doing it in my own life as well as sharing it with other people. So let me unpack that a little bit. She started doing this stuff, and like maybe 2 months later, she was almost a completely different person. Actually, it was more like 4 months, I think it was. But the point is, she got her life back. The point is, she started to learn and like in a more integrated way, quiet her mind and learn to stretch, and not just like, okay, I'm stretching this joint, but like I'm stretching my entire upper body, right? And so let's just unpack why that is. Quieting the mind is really important, as we know. And if you're listening to this, you probably know that increased stress can actually increase pain transmission. It makes the pain transmission system more sensitive. It can also it can shift the body towards an inflammatory state. It can actually shift in gastrointestinal function that can create inflammation, that can lead to increased central pain. But there's also these direct effects on the way your motor movement system works. So what is the movement system? The movement system is your bones, your muscles, your joints, your connective tissue, and the integrative neuroanatomy that holds it all together. And so what I've learned from studying rehabilitation science and working with lots of people and studying these integrative mindful movement arts is that the patterns of movement are profound. So there's kind of 3 or 4 ways, depending on how you break it down, about why stress affects your movement system and why it's so important for you to take a calm, quiet, compassionate, present mind and bring it into your body in the way you move. The first has to do with the reflex systems that get out of whack when you have trauma and stress. Every level of your spinal cord has reflexes to control movement. And those reflexes are integrated in various aspects of your physiology. Let me give you an example. I want to bend my arm so I contract my biceps muscle. So when I make that signal to contract my biceps, there's immediately a reflex that goes to my spinal cord and inhibits, it turns down the contraction of my triceps. So this muscle relaxes while this muscle contracts, and I get a smooth contraction. It's been well demonstrated in various models, back pain, other places, looking at neuromuscular activity, that what happens in chronic pain is co-contraction. The reflexes get confused. So when I'm trying to bend my arm, I'm also trying, so to speak, to straighten it. So I might be bending my arm, but I'm working against myself. And that creates pain, that creates more tension, that puts more stress on the joints, more stress on the muscle, fatigues the muscle. And because your reflexes from segment to segment to segment of your spinal cord are connected with each other, there's like these neurons that go in between. So those effects can propagate down your arm or up to your neck or up to your head. And that's part of why we see this phenomenon where people will have one area that's hurting and then suddenly the pain moves down the arm. Why is it hurting now? The problem was here. I got hurt here. Why is it going up to my neck? Why am I getting a headache? Why does my jaw hurt? Why do I get sinusitis and sinus pressure when I get neck tension? It has to do with all these different levels of interconnection that are going on. And in my experience, when people are just going out there and trying to lift weights and put a lot of force into it, they're not correcting that reflex confusion that's happening. So let's get to the second part, and that has to do with integration on a structural level. So in the world of osteopathy, we think a lot about that. And when I went to conventional medical school, we basically looked at, sorry to say it, we looked at dead embalmed bodies in anatomy, and that's how we studied anatomy. We studied dead tissue that has been embalmed. The life has been just squeezed out of it. There's no vitality left. There's no fluidity. It's like cardboard. From studying more fresh people, sorry to speak about it that way, but what anatomists have discovered is basically that there's an incredible system of connective tissue that we call fascia, connective tissue, whatever, it's a whole discussion in itself. But your connective tissue system is integrated, head to toe, bones to skin. And there are patterns of fascial interconnection that travel all the way down the side of your body, from the bottom of your feet up to the side of your head, up from the bottoms of the soles of your feet, up your whole back to the base of your skull, from the front of your body, deep in front of the spinal cord, going up for the front of the spine, connecting to the base of your skull, and other patterns on top of that, rotatory patterns, spiral patterns. And that connective tissue is alive. It's vital. It responds to stress. It responds to trauma. And that's part of what really good body workers work on. And that's part of what mindful integrative movement works on. Because, for instance, you might learn a stretch for your shoulders like that. But if you go to a really good yoga teacher, they'll get you into a posture where you're standing like this and you stretch up to the ceiling like that. So what that is doing is creating a tension all the way up my front line, into my belly, into that core line, depending on how I work with my back. It's stretching my whole system from bottom to top. And you do that in enough directions, you start to open up your body. Similar things are true in the Tai Chi Qigong system, right? And what I want to add is that it's not just about opening up these tissue planes and connections, and it's about bringing quiet and relaxation to it. So for instance, when I get into a quiet meditative state and I'm breathing and I'm doing a simple motion of opening and closing and breathing and exhaling, my body's relaxing, my reflexes are softening. I'm actually coordinating the upward movements and the downward movements with the movements of my breathing. There's a training that's happening. There's an integration of movement. And then I rotate, and then I counter-rotate, and then I roll to the other side. And so there are these patterns of movements that are opening up these tissue planes and doing it in a relaxed way and working through the entire integrated system of the body. One of the principles that I teach in Movement Towards Health is what I learned from my first Tai Chi teacher, which is unity of motion and moving like you're moving through water. So it's really profound. It's completely different than exercising in a gym or going to a physical therapy place where you're pumping iron and pushing in no pain, no gain, right? Unity of motion means when I move my right hand in this direction, the motion is starting at my foot in a relaxed, coordinated way. So I'm getting maximum power with maximum softness and relaxation. And that's where the freedom comes. That's where it opens up and releases fascial planes. It releases disordered reflexes. And it actually enables the body to function more effectively. So just to kind of sum that up, what I would say is like this, that when you learn to bring a meditative, quiet, compassionate mind where you're not struggling and efforting and judging yourself and judging other people, but you're just there and quiet, and you bring it into movement, and you do movements that are specially designed to integrate all the different patterns of movement, head to toe, bones to skin, then what happens is you start to shift your body in a deeper way. You release maladaptive reflexes. You reestablish normal movement patterns. You release the connective tissue and fascial system, and you start to sort of empower a greater degree of freedom of movement. And part of what comes from that is greater confidence. Because my experience over and over again working with people with chronic pain is that there's just this frustration and fear, like I'm never going to be able to move again. I'm going to get worse and worse and get disabled. And my experience is that that's just not necessarily true. And that if you actually go into it and work on it, and you learn to get to a quiet space, and you learn to move from that quiet space, you'll be amazed at what can happen. So my suggestion to you is that you find some way to learn integrative mindful movement. And look, it's best if you can find someone where you are and do it in a studio with someone in person. And that's amazing if you can find that. And if you can't find it, that's what Movement Towards Health is about. Because first of all, some people just don't know where to look and they don't know who to rely on. And second of all, we live in crazy times and people aren't really even free to start moving around in all places yet, and people are still scared, and you might just be kind of stuck in your home, or you might not have a place that you can go. And so what I'm doing is creating this program of training that's available anywhere, anytime, and is very affordable, and teaches integrative mindful movement along with meditation and self-care and kind of enhanced mindset towards healing. So you can actually see the link there, and you can check out the information page and sign up page. Or if you have any questions, send me a message either by email or by PM, and I'll be happy to respond if I can. Thanks a lot for watching, and please don't forget to share this. Thanks.